Hello, my name is David Hines, and this is the third in a series of videos I'm producing where I apply modeling and analytics to better understand COVID-19. As I've said before, I'm not a medical doctor or a public health expert, but I am a modeler. And in these videos, what I'm trying to do is apply decision science principles to understanding and hopefully managing this coronavirus pandemic. So in this video, I'm demonstrating what I call the infection calculator. And you see it here on the screen. And it's used for two purposes. One is to determine the current infection level in your county. And two, to project out the infection levels in your county for 60 days, depending on different assumptions. That's the what-if modeling part of it. So in a previous video, I showed some of these metrics at the state level, but as I mentioned in that video, the action really happens at the county level. That's where the policy decisions are made. That's where there are significant variations in the status of the virus in different counties. So we really need to look at the county level to understand what's going on and to make some informed decisions. So let's go ahead and look at it. I've pre-entered some data here. Let's go ahead and enter the data from Broward County here in South Florida. And there you go. So let's walk through it. So the population, you have to enter that. And so the population is 1,950,000 in Broward. The date of action, which we're assessing tomorrow, is May 17th. And that is the day we're starting phase 1 reopening. So it's an important day. The most recent 7-day total of cases in Broward County is 445 cases. That and the R numbers come from this data source, COVID Act Now. There's the link. It's the best repository I've found so far of county level COVID data. So that came from that site. And then that site also calculates the R number. That's the transmission rate. And I've talked about it before, but just briefly, an R of 0.9 means that essentially 100 people who are contagious this week will infect 90 people, 0.9 or 90% of them next week. So 100 this week become 90 infected next week. Those contagious people infect another 0.9, and so they become 81 infected people the following week, and so forth. So when R is less than 1, the number of infected people in any given week is going down and down. So we obviously want it to be there. When R is equal to 1, 100 this week infect 100 next week, and 100 and so forth. So the number of infections stay constant. But when R is greater than 1, that's when you have a problem. So for example, if R is 2, which is a crazy high number, 100 people this week who are contagious will infect 200 people next week, and those 200 will infect 400 the following week. And that leads to that explosive exponential growth that has been talked about. So that's the R number. This is going to be the what if field. We'll come back to that. So today, or tomorrow, basically, May 17th, the calculator is saying that there is 23 is the infection level. And how do I calculate it? It's mentioned here. Infection level is the 7-day case total per 100,000 population, per 100,000 capita. So the 23 is just taking the 7-day total in Broward, 445 cases over the past 7 days, divide it by the population, and multiply it by 100,000. So it's a reasonable number. So there it is, 23. And I like to actually refer to that in terms of degrees because it's kind of like a heat measure in a sense, and you can compare it from one county to the other. So basically our heat measure or infection level here in Broward is 23. Or you can say 23 degrees. Now, right below it says the likely infection level, likely, is actually 18 degrees. And why is that? Well, let's come over here and look on the chart. So you see the red line is the actual reported cases right there, and that's the 23, based on the actual number reported so far. But below it, this is the likely number of cases. There's your 18. And the reason it's different is because of this 2-week reporting delay. Infections that happen today typically don't get reported for 2 weeks. Why? I get infected today, I'm asymptomatic 4 or 5 days. It takes me 4 or 5 days to get a test, 4 or 5 days to get it back. All that consider, and a portion of people are asymptomatic the whole time and are not tested at all. So the history has shown that a 2 week reporting delay is probably about right. So what we're seeing in cases today is actually happening 2 weeks ago. And in this case, it's actually not a bad thing because we think we're at 23 degrees of heat, but we're actually even cooler at 18. It's not always a good thing. So let's say that the actions we take tomorrow are going to raise the R by 30%. So I'm going to go ahead and put that in, and let's see what happens. Well, what it did, it drove the R up to 1.17, right? Because at 0.9, a 30% increase drives it to 1.17. Now, I don't know it's going to be 30%, but it certainly could be. And so when that happens, the infections, here we are May 17th, the infections immediately start going up because now the transmission rate is higher. There's more opportunity for infection. But what happens to the reported cases is they keep going down. So over the next 2 weeks, they're going down. We're thinking we're in good shape when in reality, the infections are growing on us. That's the negative effect of this 2 week delay. So when we get out here to the 2 week point, the reports show we're at 18 degrees. We're really at 25 degrees. And that spread continues going forward. So this whole idea of infection level and the 2 week delay, very important. We don't really talk about infection level directly. We talk about it indirectly because we talk about hospital overload, right? We don't want hospitals to be in critical situations, overloaded. That's really the result of the infection level. So you can see down here, we can actually calculate how many specific ICU beds are going to be required because we're running at this rate of infection. We have this level of infection right now. And that's based on the typical hospitalization rates that we've been seeing with COVID so far. So this says that at this level of infection, we'll be needing 25 ICU beds to handle the infected people. Right below there, you see the total number of ICU beds that we probably have, 667 beds in Broward. That is based on U.S. average of 34.2 beds per 100,000. Here's the reference to it. So it's going to be plus or minus depending on a particular county, but it tends to be pretty close. I've checked the numbers with some counties, and it comes in very similar. So then here, COVID load is a percent of total beds. So we're going to need 45 beds for COVID. We have 667 ICU beds. So we're taking up 7% of the beds with the COVID patients based on the current infection level. So let's see what these colors mean. Over here, I've set up this hospital system stress level. So at that level, we're in the green, which means we're only using between 1% and 9% of ICU beds for COVID. Not great, but it's still not bad. The impact on the hospital system is pretty low, considering that usually we have in the range of 33% beds available. So we're not using all the available beds. We get into the moderate range is between 10 and 33% of ICU beds. That's when we're getting close to filling up all the available beds. In the high impact area, now we're at 34 to 99%. Now we're kicking patients out, basically. We're using beds that are normally used for other purposes. And in reality, sometimes those beds open up because people don't want to go to the hospital, but that's not a good thing either. When we get to the severe level, we're now actually 100 to 200% of the ICU. So now you have all COVID in the ICU, people in the hallways. It's really a nasty situation. And when you get to 200+%, it's really very horrible, and you want to try to avoid that. So that's what the colors mean. Now, I do want to mention, ICU beds and the impact is so important for a number of reasons. Why is that? Certainly, it's a health impact, right? I mean, if ICU beds are being filled up, we have people being sick, so it's an individual issue. but it's also a public health issue. It's a public health emergency because once you start stressing your hospital system, people know it and they don't want to go to the hospital. As I say, that's which is bad. People end up getting sick at home and sometimes dying at home when they didn't need to die. And also, what sometimes we don't realize is when you start stressing the hospital system, you're going to actually hurt the economy because people are going to tend to stay home, regardless of what's open. It's our behaviors that really drive the transmission rate. Um, Policy makes a difference, but it's ultimately our behaviors. So as we try to balance the health impacts with the economic impacts and balance those, when you start overloading your hospitals, it's like the worst of both worlds because you're hurting public health and you're hurting the economy. Okay, so beyond ICU beds, the infection level also drives deaths. Okay, the higher the infection levels, the higher the future deaths. And again, these numbers are based on typical experience we've had with COVID. So far in Broward, we've had, I think, 258 deaths is what it's showing. But at the current levels, we'll continue having 22 deaths a week. And of course, you can play out under different scenarios how many more deaths a week. So, for example, if we did have that 30% increase that I mentioned, as of tomorrow, if that has a 30% impact on R, not only will you see these increasing impacts on the ICU, you see as 60 days out here, we will be now into the next level up. We're having more of a moderate impact on the ICUs, but deaths per week go from 22 up to 51. Now, one other impact, again, of the infection level that's really not talked about is the idea of the likelihood of becoming infected. How many contagious people are running around in your county? Right now, in Broward County, there's about 8,900 people running around, hopefully at home or maybe in hospitals, that are contagious. Okay, that assumes a 7-day contagion period, but it's based on these numbers. It does assume a 20 times multiplier, meaning that the cases being reported, the 445, in reality, it's probably 20 times that. Now, it might be less, it could be more, but that's the assumption here anyway, that if that's true, 8,900 people are currently contagious in Broward County. To make it have some meaning, I always like to think of like an NBA arena with 20,000 seats. So if you were sitting in an arena with a random selection of Broward County people of 20,000 seats, you would be seeing 91 people in that arena that are contagious right then. And of course, going up, by the time you get out to here, you have 20,000 total, which would be 200 people, 207 people in the arena. So that relates to your likelihood of getting infected. Obviously, you can control your actual infections depending on your personal behavior, using masks, washing hands, and so forth. But it does indicate the likelihood that you'll encounter somebody who's contagious. And this infection level also lets you compare how dangerous it is, in a sense, to be in one county versus another. So that's something we really haven't talked about that I think is useful. All right, so let's see what happens in Broward. So at 0 impact, obviously there will be some impact tomorrow. So let's say the impact of the phase 1 opening tomorrow is 10%. You can see that's not bad at all. We're staying stable. The reason is R still stays below 0.99. Now when we go to 20%, all right, then we start to see a reaction. 30% more, that's the one we looked at before. We're beginning to see moderate impact on the ICU. 40%, still moderate, but more rapid increases. You see that exponential growth. And again, you see the disparity between here's where you think you are and here's where you really are 2 weeks out. And 50%, which I'm hoping is unlikely, but would lead to very serious growth in infection, and we'd even be into a high impact situation on the ICU 60 days down the road. Let's look at the neighboring county. So Miami-Dade is to our south, Palm Beach is to our north. So let's look at Miami-Dade. Okay, so Miami-Dade, their current infection level, based on 40 degrees, which is hotter than it is here. There's more infection in Dade, but their R number is a little bit lower. So they're in pretty good shape, really. You can see if they don't do anything, the R number is going down, the cases are going down. So let's see, you go to 10%, not bad at all. They only brought the R up to 9.97. We're still controlling it. 20%, still not bad. 30%, it starts to have an impact and so forth. So if you go up to 50%, it can be very serious. So the fact that R is lower does give them more room, more tolerance to change in R. So you can be a little more ambitious, for example, but you still have to be cautious because we don't know the impact. Now let's look at Palm Beach to the north. Okay, Palm Beach is already not in a good situation because they're 47 degrees of infection, which is hotter than both Dade and Broward. But especially important, the current R number is 1.1. They're already growing. If they didn't do anything tomorrow, they're going to be, stressing their ICUs going forward. So even a 10% increase Monday, you can see it's going to, within 60 days, put them into a high level of impact. You see the growth here, 20%. It just starts going crazy here. You're getting into a very severe impact, 30%. I mean, 50 seems unthinkable, even though it's possible. So that's why looking at these two numbers is so important. You need to understand both the infection level and the R number, which is the transmission rate. It's the combination of the two that's so important. Now, to give some context to the infection level, I've put over here some kind of notable peak infection levels, just so you can see what they mean in a sense, because these are some of the highest levels that have been reached so far in the pandemic in the U.S. And so let's go ahead and take a look here at Rockland County, New York. They reached a peak infection level of 979 degrees on April 5th. That represented an extreme impact. It's the highest impact I've seen so far among the cases I've looked at, based on just entering their 7-day case total and their population. Now, fortunately, since then, in the 39 days since then, they've come down 882 degrees. Now they're down to 97, which is great. So they're now down into just a moderate impact on their ICUs, and they continue to go down. But why were they at the top? Well, if you remember Westchester, New York, that was where that lawyer very early on started infecting people during his commutes. So Westchester actually peaked March 28th. Rockland's right across the Hudson from Westchester, and so they peaked, 8 days later? After that, you had Nassau County, which is down right near Manhattan, 3 days later, peaking after Rockland, and then Manhattan itself 6 days later. Okay, so you can almost see how it spread throughout the New York City area. But thank goodness all of these now are down into the moderate impact. Nassau's down to 25%, Westchester 33%, and Manhattan 18%. So that's the result of social distancing, of doing a great job of getting it down. All right, then you can look at Orleans. That's, of course, New Orleans. The deal with the Mardi Gras, which was on February 25th, and then 6 weeks later, Orleans County became the second highest peak that we've seen, 797 degrees. Again, they're down greatly. They're almost ready to go into the low category, so they've done a great job of social distancing and behaving properly. Minnehaha, I love that name, South Dakota. This is Sioux Falls. This is where that Smithfield meat packing plant is. So they reached 737 degrees not that long ago, April 25th. Okay, the meat packing being kind of a super spreader. And they went down, but they're still in a severe impact on their ICUs, 119%. We have Bergen, New Jersey, Doherty, Georgia. That was that small town in southwest Georgia where they had the funeral back in February 29th. And back then they, weren't doing mass social distancing. And so again, within a matter of weeks, they were at 594 degrees. Again, they've since then social distanced, so they brought it back down to now where they're only 22% of ICUs. Fairfield, Connecticut has come down, but it's still fairly hot. Michigan has come down. Massachusetts has come down. Cook County, Illinois, Chicago, they peaked just recently. They're in a high impact area of the ICUs, and they haven't come down much. They're still up there. Same with Iowa. That's another meatpacking situation. They're still on the high side. Pennsylvania's come down some. Nebraska, they're just peaking now and continuing up, another meatpacking plant. I'll come back to Miami-Dade. Let's look at Los Angeles out on the West Coast. They peaked back in late April at 21%, but they've had a hard time getting it down. They're still only at 17% ICU. So their temperature, if you will, their infection level has gone from 72 degrees down to 59, but not a big drop. King County, Washington, Seattle, which was one of the early victims of the pandemic, peaked back in April 8th, and they've done a real good job. They never let it get out of hand, and now they're down to 6%, which relates to 21 degrees, and that's in the low impact category. Finally, Miami-Dade. Miami-Dade did peak April 8th. They were up to, what were they, 120 degrees. They're now down. They've come down to 43 degrees, and they're in a moderate, ready to go into low impact. Why Miami-Dade? I believe, international destination, probably a lot of Europeans coming in, had an influence on that. Broward County here, we are just to the north. We peaked 5 days later, not as bad. And then Palm Beach is still peaking. So you kind of saw that already in the numbers we looked at. Broward has brought their ICU impact down into the green, low area. Palm Beach is not, and they're actually on their way up. So to wrap up, there's really two key ideas we've been missing, and hopefully you can see it from this video. One idea is this whole idea of the infection level. Okay, it's one of the two key numbers, infection level and transmission rate. Those are the two key numbers you need to know to assess where does the virus stand in your county. The other key idea that we really don't talk about is this 2-week reporting delay, that we actually are blind for a 2-week period. And therefore, this coming week, don't expect cases to be jumping up in South Florida, even though we're opening Monday. I wouldn't expect to see that impact, that echo, until probably 2 weeks later. Recommendation to policymakers and really everyone, use this tool to understand your county's numbers, the infection level and the R number, the transmission rate. Both of those are available from COVID Act Now. You can then use those numbers to project out where infection level might go, and then it can help you to determine how ambitious you want to be in your reopening plans. Again, we don't know how those plans are going to affect the R, the transmission rate, but we know it'll go up. We just don't know how much. So it's an experiment. It's trial and error, and we want to just try to keep the error from really biting us. There's no magical formula. It's judgment. But the more you know about it, the more informed a decision you can make. Again, all this data is publicly available in COVID Act Now, usually about 2 or 3 days old. And that site has the only public calculation of R number that I know of. I've posted this spreadsheet to my website, which is essenceoflean.com. And I hope this has been useful, and I thank you for listening.